Each year, approximately 91,000 people get sick of TB, with 32% of these being HIV infected. The Global Fund is one of the international agencies that is assisting the government in its fight against TB. The Country Coordinating Mechanism oversees all Global Fund programs in Uganda. Officials from the agency have now been in the eastern part of the country, in Mbale and Tororo districts, to monitor TB outbreak.
There and check and see what is going on. Are things going according to plan? Are people implementing? Are the resources being spent as was planned? Are the recipients, the health workers, are they being supported, facilitated to do their work?
They have found that the disease has increased in these areas. In Tororo District, 350 TB cases were registered last year. However, from January to June this year, 215 cases were registered, which shows an increase.
Well, now this is just half the year, and they have got 215 cases. So they are likely to go above the target that we set for them.
And one of the reasons that can explain this is the fact that there are so many TB missed cases that we can't find and which continue infecting others in the communities.
Although tuberculosis is curable, one of the biggest concerns is that they have registered 6 drug-resistant TB cases in Tororo since the year began, which continue to spread the disease.
There are over 6 cases of MDR-TB in Tororo alone and close to the border points, and that is not a desirable situation.
We have multi-drug resistant TB, and that means that the drugs we have are not able to cure them. And if that TB is spread, it means more people will get TB which cannot be treated and cured.
At the Uganda-Kenya border in Malaba, efforts have been made to ensure that people from Kenya do not bring the disease into Uganda and all are screened before entry.
We have what we call the gene expert machine at the border, which can help us to detect TB in case we suspect somebody has TB.
Ending TB by 2030 is a priority for the government of Uganda. The Global Fund announced that it will be releasing $587 million to the government of Uganda for battling malaria, HIV and tuberculosis. HIV/AIDS will receive $288 million, malaria $267 million, and TB $31 million. Habat Kamoga, NTV.